COVID was never going to be the last public health crisis we face, and neither is monkeypox. The question is not whether there will be a new threat, it is when it will strike and whether we will be ready. The truth is, the monkeypox response so far has not been encouraging, but there are some clear signs of progress, and there are clear steps that we can and should take to improve. And I don't want to just hear today about the steps you will be taking. I do want to see action.
I'm glad that we're finally here having a hearing on monkeypox outbreak, and it's as it hits our nation. While monkeypox is now a public health emergency, it didn't have to become one. I think the one promising thing that can be said this morning is the infection rate has slowed. That may be the only thing. Since May, when the first transmission was reported in the UK and Europe.
Over the last several weeks, we've been pleased to see a decline in the growth of new cases here and abroad, though there are areas in the United States where the rate of rise in new cases is still increasing. We approach this news with cautious optimism, recognizing that we must continue to aggressively respond to with our entire toolkit, including vaccination, testing, and education about risk to inform behavior change.
FDA has been actively working with our government and private sector collaborators to respond to the continuing public health threat since the first monkeypox case came to the U.S. We've been working diligently to help ensure access and proper information regarding vaccines, diagnostics, and treatments for those who need them most.
We continue to maintain our smallpox preparedness. That's critical. Our frontline vaccines continue to be available and have not been impacted by our monkeypox response. But we have added the capability to be able to provide the Jynneos vaccine to those that are immunocompromised in the case of a smallpox outbreak. And we are evaluating with each dose that we make available to the monkeypox outbreak what it means for that preparedness in smallpox.
Lessons learned during the response to AIDS and COVID-19, such as avoiding stigma and ensuring the medical countermeasures get to where they are needed most, should help us in our efforts to respond to the ongoing monkeypox emergency. In addition, the U.S. response to monkeypox should in turn help to inform our response to the inevitable next emerging or re-emerging infectious disease of pandemic potential.
I think that we've now had multiple infectious disease crises in a row, and we are learning from each of these. But it's really important to invest in systems and actual sustained funding for both the routine public health activities, which is the foundation for our ability to respond in an emergency. If those systems are weakened, if they're not reinforced and sustained with funding, if those people are not there, then we do have these failures of the ability to respond from one emergency to the other. And so we as BIO really have been advocating strongly for sustained, increased and sustained funding for both the public health community, but also the work that happens within the ASPR for medical countermeasure development and procurement and sustainment, and the surveillance and other capabilities that's so core to the CDC. Those two areas need to be robust and they need to be continuous, because we never know when we'll have multiple emergencies sitting on top of each other as we do now.